What types of maxillofacial trauma do oral surgeons treat?
One of the most common things that oral surgeons do is treat facial trauma. This can include soft tissue trauma of the skin or trauma of the facial bones. Patients present with various types of trauma from gunshot wounds, car accidents, assaults, injuries during sporting events, or just the common fall. Patients can have fractures of various types of facial bones. This can include the upper and lower jaw, the nasal bone, the eye sockets. Patients can also have trauma of the oral cavity where they can knock out teeth or displace teeth. This can also include lacerations in the mouth of the gum tissue or cheek tissue. So depending on the type of trauma that a patient presents with, we will either do treatment in the office or go to the operating room. Patients that have facial fractures will require placement of small plates and screws in order to put the bones back in the correct position. If the patient has, for example, a displaced tooth or they have knocked out a tooth, we will then have to sometimes put the tooth back in place or remove the tooth. There are certain situations where we have to splint the teeth together with small little wires in order to hold the teeth back in the correct position. Because we have 12 doctors in our practice, we have the ability to have someone on call at all times. If you call our office with an injury or a trauma, there's always going to be a doctor available to talk to you and guide you in the next best step.